everyone. Welcome back to the afternoon of the second day. And we are so excited to have Dr. Ashwathika Ashok joining us from Coimbatore, where she is a naturopathic physician and a senior midwifery student. It's so exciting to have your insights. And in case you want to know, she is also an Instagram influencer. So you can follow her on the IG, get lots of great reels going. And she's also a dear friend and student of mine. So I'm so excited to welcome you, Dr. Ashu. Please take it away.
Thank you so much, Augustine. It actually feels so great to be here. It felt great when you said senior midwifery student, because I think it feels like an accomplishment to keep going through midwifery. It has not been an easy journey, but it has been a lovely journey. And I think I would still have chances to continue doing births, to continue learning, and someday make you proud. Today we're going to be talking about infertility and how we could treat infertility through naturopathy, or a naturopath's perspective towards infertility. So, as Augustine mentioned, I am a naturopathic doctor and I practice full time as a naturopathic physician as well. There was a gap in between when I left Bangalore, came back to Coimbatore, and I wanted to keep in touch with something related to birth. And that is when I got this opportunity to work with a lot of preconception clients, and I've been doing it continuously. And on an everyday basis, I meet one or the other who feels or who finds some difficulty with fertility, or who finds difficulty conceiving, or there are people who come after they conceive and then they have a lot of nutritional deficiencies. So these are the people that I'm seeing currently on a daily basis. So we all know what infertility is. So infertility is nothing but the inability to conceive after adequate sexual exposure without any contraception. So if you're someone who's within the age of 35, then you have to go on for a year trying to conceive, and if you're not able to conceive after a year, then we call it as infertility. Whereas for people above the age of 35, if they go on trying to conceive for 6 months and they're not able to conceive, then we call it as infertility for them. Okay. So, according to World Health Organization, they say infertility as a global problem. It has been affecting a lot of people, and the rate of infertility has been proportionately increasing so high over the last few years. And through a lot of researches and experiments, it has been found that 1 out of 5 couple experience infertility. So look at the rate of infertility, and this is quite alarming because a lot of people are taking it to an extent that it affects their physical health, emotional health, mental health, and it also affects the people that are around them. So World Health Organization has been working towards a lot of programs, and they are trying to introduce those programs right from people who are in the rural areas to people who are in the urban zones. And let us see a little bit about naturopathy and how we could bring both of these together. So when we say naturopathy is actually a traditional system of medicine. But current day naturopathy, we are trying to integrate the traditional practices along with science to give people the best of its essence. So naturally, we are not living the life that we used to live like 50 years ago. The environment is not the same. Our lifestyle is not the same. And there's a drastic difference in the way we live, in the things that we do. And so the same old traditional practices as it is might not be of great help if not integrated with science. So today, the current day naturopathy is focusing on bringing the traditional form of practices or all the small lifestyle factors in a best suited way for the current generation. So the two major principles are holism and vitalism. So if you come to me and if you're going to ask that I have a leg pain, look at, I'm not going to just see to your leg pain, but rather I'm going to look at you as a person, as a whole person. That is what we call as holism. And vitalism, every little factor, every little nutrition, every little differences, or everything that your body has to go through should be in a normal pace. If that is not going on right, then we have to bring it back to recorrect it or reverse it and bring it back to normal. This is what comes under vitalism. Okay. Let's talk about types of infertility. There are two types of infertility. One we call as the primary infertility and the other secondary infertility. So primary is when like the person has not had any child before. They are trying to conceive but no successes. That is what we call as primary infertility. Whereas secondary infertility is when the couple might have one or two kids before, and then after when they are trying to conceive, if they're not able to conceive, then we call it a secondary infertility. So both of these are quite common, especially if the women who has undergone their first pregnancy has not had the right kind of nutrition, not had the right kind of care, then there are high chances the person might experience a secondary infertility. But apart from these two types, there's one other important type of infertility. Any idea, anyone?
Unexplained infertility.
No. Yes, unexplained infertility. And this unexplained infertility accounts to about 15 to 30% of the infertility cases. And when we call it as unexplained infertility, is that you get all your medical parameters right and still you do not able to conceive. That is when we call it as unexplained infertility. And of course, when we get into the mainstream of medicine, we follow the same protocol as the explained infertility for the unexplained infertility as well. So these cases, when they undergo IVF, IUI, and all these sort of treatments, sometimes they don't get success rates. They go into 3 cycles, 4 cycles, and then they lose hope. And that is when I get to see. So I have an interesting case history of one woman who came to me with unexplained infertility. So this woman was like 36 years old and she was married at 23 and she's been trying to conceive from 23 onwards. And this woman, when she first went to the doctors, they told her that she has a septate uterus. I'm sorry, I mentioned it as retroverted. She had a septate uterus and they did a surgery and they said, you're fine, you'll be able to conceive. And then she was not able to conceive again. And then when she went back again, they said that the septum is developing again. We have to go in for a surgery again. And they did the surgery again. And then they were trying to conceive again. It was not happening. And then they suggested her to take up IVF. And she had like 2 cycles of IUI and then 1 cycle of IVF, I hope. And then she lost hope. She was like, no, I'm not doing anything more. And but then she was trying to conceive naturally. It didn't happen. And again, when they went to the doctors back, they told her that the septate uterus is the problem again. And then she wanted to take a second opinion. She went to some other doctor and she told, no, it's only like 5 mm or so. So you don't have to worry about the septum that's growing. And then she was like, okay, let's try one more cycle of IVF. And this woman was not interested. And then she came here. She told me that a lot of people are suggesting that my weight gain is the reason behind my infertility. So can you help me with this? Then when we examined her and when we did all the stuff, the thing that we found out was she was storing in a lot of stress in and around her hip region. So it was very, very tight. And when we asked her, she explained that she had a very bad dysmenorrhea. Every time she gets periods, her life is like torn into pieces. She cannot do any of her work on the day of periods or through her periods. And then we gave her a few therapies that we're going to discuss in the later part of this presentation. And after those therapies, she felt good. She went back home. And after 6 months of this, she got pregnant on her own. No IVF, no IUI. So this is how unexplained infertility cases have certain out of the box things, sometimes beyond science, sometimes things that research papers do not talk about. But they do have some significant issue that is holding them back from getting into this beautiful journey of pregnancy. Globally, it's like 1 in 5 couples suffer from infertility. In India, 1 in every 15 couples suffer from infertility. So 40 to 50% of the troubles come from female reproductive system and 20% comes from male reproductive system. So this is all statistics pertaining to India. And globally, like 50 to 80 million couples at some point of time suffer from infertility. So it might be primary, it might be secondary, but at some point of their life, they do suffer from infertility. So 33% of the causes involve the partner assigned female at birth, and then 33% 33% involves the partner assigned male at birth, and 33% involves both the partners. 25% of the infertile couples have more than one factor. So it's not just, so this is what is causing infertility. There's always like a cluster of things that come together to cause this infertility. So when we go by terms, genetic factors, endometriosis, any trouble or any disorder that is associating to the uterus, sexual dysfunction, menstrual disorders, and then varicocele of the testes, the steroids misuse. Usually people who go for workouts, who are into bodybuilding, they tend to use these anabolic steroids a lot. So that misuse can also lead to infertility, injury to the reproductive organs, both in male and female, undescended testes. All these things could be causes for infertility. Coming to the risk factors, your age. So generally it is said that beyond the age of 38, women tend to lose the chances of getting fertile, and beyond the age of 50, men lose the chances of getting fertile. With weight, underweight as well as overweight might be factors that affect fertility. Sexually transmitted infections, smoking, alcohol habits, environmental factors. When we say that, it includes pesticides, the nature of your work environment, all of these things. Stress, hormonal imbalance. If you're into radiation therapy for any other treatments, then radiation therapy. Eating disorders, like we tend to see people who eat and then vomit the particular food that they ate because they wanted to maintain slim, right? So we call that as anorexia nervosa. So conditions like that, then over exercising or any substance abuse, all these things could be risk factors. So one thing I liked about this picture from the World Health Organization is they have mentioned certain medical treatments to be a part of all these risk factors, because a lot of us don't understand what could be the side effects of a particular treatment before we take the treatment. So whenever we are getting into any procedure that is pertaining to our health, it's always recommended to know what are the benefits, what are the risks, are the risks over the benefits. So is it absolutely necessary for you to take this treatment, or are there any other paths? So this is very important, because sometimes the littlest of the mistakes that we tend to do unknowingly could result in a multitude of disorders, and infertility could be one of them. How naturopathic modalities can help? Basically, as I said before, we look at the whole person. So it's not just about this particular thing or that particular thing. We take the whole history, right from their current conditions, the past history, surgical history, all medical history, their family history, any similarities that's going on, that's running, any particular disease that's running in the family, environmental exposure, physical activity, their sleep patterns, their diet, what is the nature of work that they do. So when a person comes, we have to evaluate them physically, emotionally, spiritually, psychologically, at all these aspects. So we get a whole picture of what this person actually is. So when we try to do that, we get few hints on why they are going through this particular trouble. And finally, how all these symptoms together has manifested inside your body. Let's say, for example, a person is coming with diabetes, or a person is coming with PCOS. The ultimate aim initially should be to treat the underlying disease, unless and until it is controlled. Any metabolic syndrome that they come with, we have to control that particular metabolic syndrome, and then we should be helping them to get pregnant or helping them with conception. We see this tree, right? So every time we see some problem, or it's simply the iceberg phenomenon, all that we see on the top is only little, but inside, if we go dig deeper and deeper, we always find a lot of causes that are stuck inside or that are hidden inside. So what we see on the top is always the symptoms. So what we see inside is the real cause. So when you get to the real cause, that is what we call as the diagnostic point. When we get to that real cause, it'll be easier for us to get this problem sorted. Dietary regulations. So from here onwards, I'll give you one story behind every particular modality that is being used here. Okay. So dietary regulations, diet, as we all know, can exert a positive influence, and it also has the ability to exert a negative influence on our health. It's not just with fertility, it's with all other things. Let's say, for example, a person who's trying to lose weight, if that person is not correcting the diet and continuously depending on exercises, it is not going to happen, right? If you see a diabetes patient, a person who's suffering with sugar for a longer period of time, they'll be put on insulin, they'll be put on medicines. But if you see after a year, after 2 years, their medicine dose will keep increasing and it will not decrease because their food pattern was not right. So a lot of people today are getting their medicine doses increased every 2 years, every 3 years, because they are not correcting their lifestyle. But also, on the other hand, we would have seen certain people who would have had diabetes from earlier stages, but they would still remain all well, even at 80 years, 90 years. It is because they were able to control their lifestyle, they were able to adjust their dietary habits. So when it all had a positive impact, the body could help you positively in maintaining the medicine dose or in reducing the medicine dose rather than increasing it. The same way, the food that you choose every day has a great influence on your conception. The first thing is, all of us today have this habit of including junk foods. But to say junk and foods can never go together. Junk is junk and food is food. So when you're able to eat a whole lot of lively foods, that in itself by 50% improves your chances of fertility, is what we see a lot here. Let go to the other end. I've seen a particular woman who was at her 25 years of age, and then this woman came to us with the concern of PCOD. And then when we looked at her reports, she did not have exactly PCOD. All that was there was high prolactin levels. Her USG was completely normal. And then when we spoke to her about her routine and all of that, she said that I have a very disturbed routine. I usually work night shifts and then I come back and my mornings are quite disrupted. So my eating time and everything is changed. And then she wanted to conceive because of the family pressure. She was like, I wanted to conceive right this month. I have my periods irregular. Will I not have a chance to conceive? She was very anxious. And then we suggested her to take off from her work, and it was possible for her. Luckily, she had that liberty to take off from her work. And then she came and she stayed in the campus for like 15 days, and her sleep routine was fixed, her eating habits were fixed. Initially she found it very difficult. She felt that too tired, she was finding it hard to adjust to the new routine. And finally, we loaded her with a lot of vegetables, a lot of good fats. And after that, like it was like 14 days. And after that, we gave her a complete diet chart, which included a good amount of proteins, good amount of whole grains, good amount of fats, and a lot more of good vegetables and soups. And she was a vegetarian, and she started with this diet, and she was going on for like the next 1 month. She was still off from work. And after that, when she had her next cycle, it was after 60 days from leaving here, and she got pregnant after that cycle. Like it was almost like 2.5 months to 3 months of time after she left the hospital. So we did nothing but to fix, rather than fixing her diet and sleep routine, and her prolactin levels were back to normal, and she was of course pregnant and happy. Then throughout the pregnancy, she did follow up with the diet, and she had a good level of hemoglobin, and she had a very good routine of sleep. And by her 9th month, I think she was induced for some reason, and then she gave birth vaginally, and then she came back to us after her delivery. And I think her baby right now is like 1 month old, and she's doing perfectly fine and happy. And I could sense one thing from the whole story of her is that the whole family, like not just her but also her partner, everyone adapted to a healthy lifestyle just after this incident, because she was just 25 years old, and it is just the little changes with her diet that helped her to conceive naturally. Trans fats, refined sugars, and all the caffeine and all those packaged products that come, they all have this thing called as xenoestrogens, which could be a very bad influence over both male and female for fertility. So here, diet should always be custom made or tailor made. We suggest someone to have walnuts, because it will be helpful to them. But the same walnuts might not be a great option for the other person if they consume it too much. So the same way, every little bit of the diet could be different, or every body perceives the diet in a different way. So when we suggest a particular diet, it is important to understand and analyze the nature of that particular person, the nature of their current diet, and remodify it accordingly. So according to the statistics, they say 45 to 50% of carbohydrates every day, 10 to 35% of proteins every day, and 20% of healthy fats might be very, very helpful in getting into a healthy lifestyle. So what happens when we avoid these refined foods, or anything that is trans fat, or anything that is that acts as a nervous stimulant? When we avoid all of those, what happens is your oxidative stress in the body gets reduced. So when the oxidative stress reduces, automatically a lot of the functions inside your body gets improved, because there's less level of inflammation in the body. The next thing that pertains to the diet is nutritional deficiencies. When you're not able to have a healthy diet, we tend to have a lot of nutritional deficiencies. And right from the birth home time, I think I've seen a lot of deficiencies that are related to vitamin D, vitamin B12, B9, B6, iron deficiencies, zinc, selenium, vitamin C, magnesium. So all these deficiencies are very commonly seen in both pregnant women and in women who are trying to conceive. The common symptoms that they express might be they'll have dryness, they'll feel a lot of weakness, they'll have muscle cramps, a lot of sweet cravings, pain in the bones, their vision might be disturbed, they have some sort of breathlessness, they have pain, they have back pain, or sometimes their nails are very brittle. All these symptoms, all these minor symptoms that we see on a regular basis might be indicators of the nutritional deficiency. So if you are seeing something different in your body, which may be as small as brittle nails or hair fall or dark circles, then if you could test yourself for that, or if you could find someone who could help you navigate it to what kind of deficiency it is, it'll be very, very helpful. I see a lot of women who come in the pregnancy or come in their second trimester and be like, they have this deficiency, that deficiency. So rather than treating them at a point where they are already pregnant, it will be very, very helpful to treat all of these in the preconception phase. And sometimes these nutritional deficiencies, not sometimes, most of the times, have a great, great impact in your journey of conception or in your fertility. So it's very important to diagnose what kind of deficiency they have, and if that deficiency can be treated well with the diet, yes, let's go with the diet. If not, the supplementation should be done in a right way. Sometimes the supplementation can be oral supplementation, sometimes the supplementation might need your help through drips. So IV nutrient therapy comes in at that particular point of time. So whenever we supplement a person through IV, or if we are supplementing the person through oral supplementation, that is fine and good to raise the levels and to bring it to a particular point. But it is also very, very essential to continue with a properly charted diet program, because your body's absorption rate or the bioavailability of a particular nutrient in lively foods is much, much more better than the supplements or any IV therapy that we do. But those therapies or those supplementations are very important in the initial stage to boost up the particular nutritional level to a good extent. And then it is very, very important to follow a proper diet to maintain that in a great way. When we are talking about dietary reformations, I think seed cycling is something that I wanted to talk about. So a lot of us would have heard about seed cycling. So for some of us, it might be a very new one. There are 4 different seeds: flax, pumpkin, sunflower, and sesame. We would have all heard about these seeds. So usually in the first half of your period cycle, that is from the first day to the 14th day, we go with flax and pumpkin seeds, 2 tablespoons of each of these seeds every day. And then we go with sunflower and sesame in the next 4 days. So what does these seeds do? So they have all these nutrients that I've mentioned here, the omega-3, 6 fatty acids, some amount of antioxidants, zinc, potassium, copper, phosphorus, and these seeds regulating your hormonal levels. So we all know that menstrual cycle is divided into two phases. One is the follicular phase and the other one is luteinizing phase. And then third comes the menstruation. So all these three phases, the hormonal levels are slightly different. Like in one phase estrogen is high and in the other phase progesterone is high. So when these changes happen, that is when your body gets prepared for your pregnancy, and then when you don't get fertilized, it just sheds out the endometrium and it is called menstruation. So for all these changes to go in a proper way, the hormonal balances should be maintained. So taking these seeds right in through the first half and second half in a right way has been proven to have a very positive effect on your menstruation. Since it has a very positive effect over your hormones, it can help you with fertility as well. So xenoestrogens, as I was talking about xenoestrogens before, so what are xenoestrogens? The compounds that mimic the estrogen inside. So there can be two type of mimicking estrogens. One, we call it as phytoestrogens, which come from the plant sources. And then the xenoestrogen, which comes from a lot of products outside. So we see these xenoestrogens in your tap water, tampons that you use, pads that you use, a lot of cleaning products, perfumes, cosmetic products, prints, the papers that you use, a lot of things on a regular basis. You might see this on every plastic thing that you see. You might see this on your regular use creams and bathing products and all of this. So these xenoestrogens, they have the capability to go and inhibit gonadotropins, the hormones that are responsible for both sperm production and egg production. So it affects both male and female, especially when you have a lot of exposure to these xenoestrogens. There is a chance that you also develop other metabolic disorders. There's also a chance that you might have been experiencing a lot of symptoms unknowingly and will be like, oh my god, why am I getting these symptoms? I was perfectly okay, I'm eating well, I'm sleeping well, my routine is good, but I'm still disturbed. Why? I have a very good routine, still I've been going through PCOS. When you have all these things happening on the end, you can understand somewhere or the other you have exposure to these xenoestrogens. So to cut off these xenoestrogens completely might be a very difficult task, because a lot of our daily use products do come with this. But to reduce the usage of xenoestrogens might not be too much to do, because you can definitely shift to certain eco-friendly things. You can definitely avoid plastic containers for your foods. At least you can definitely avoid a certain amount of cosmetic products that are bothering you or affecting you. So this is the dietary part. So in the diet, we have seen about general dietary information with whole grains, good fats, good proteins, a lot of whole fibers. And then we saw about seed cycling, and then we are seeing about... Next in the row, we'll be talking about acupuncture and acupressure. So acupressure is one form of traditional Chinese medicine. When we look at the use of acupuncture or acupressure in infertility, it helps through a lot of different angles. One, in unexplained cases of infertility, what happens is a lot of times it is very pertaining to the energy levels in the body, and we call acupuncture as energy medicine. So it comes into the picture and plays a very great role. Generally could do all these things like improving the sperm quality, egg quality, establishing hormonal imbalance, and then regulating your energy flow, blood flow. But how that happens? So the traditional Chinese medicine views infertility to be because of a disrupted energy flow inside your body. Okay, so this disrupted energy flow can manifest in three forms. One we call as the deficiency syndrome, then the other we call as stagnancy syndrome, and the other we call it as heat syndrome. So all these three, or if either of these three conditions is affecting you, then you very well have this chance of being infertile. So according to this theory of Chinese medicine, when there is a block or disruption in the sexual or reproductive function in either the male or the female, then they call it as deficiency syndrome. And if there is a restriction in blood circulation to the reproductive organs, or if there's a restriction in the energy flow to the reproductive organs, then they call it as the deficiency syndrome. And when we come to stagnancy syndrome, it is because there is a particular stagnation. Like, let's say, for example, you see swelling in your legs, which means there's stagnation of fluid in that particular area. It's because of that you develop swelling, right? Similarly, if the energy flow inside or if the blood flow inside is stagnating or is getting pulled at a particular space of your body, then it might disrupt the free flow of this energy or circulation to your reproductive organs or the organs that are involved in the conception. So that is when we call it as stagnancy. Heat syndrome. Heat syndrome is basically like, we all tell it in general terms, like, oh, I feel that my body is on the hotter side. I feel too much of heat in the body. That is, it's very similar to that. So this is more like inflammation inside your body. There's always a, let's say you had a scratch on your hand. You feel some sort of heat there, right? Then you see a bit of swelling, a bit of redness, a bit of heat, a bit of pain, all of these things together. So the same way, if any part of your body inside is getting affected like that, where the heat is increased or where you feel some sort of pain or some sort of redness, that all these things that are happening inside your body, which we cannot see, but it still is affecting your internal organs. That is when we call it as heat syndrome. And if this inflammation occurs, then there might be difficulties in the semen quality in men, or in women it can manifest as different infections like yeast infection or some sort of bacterial infection, PID. All of those things comes under this heat syndrome according to acupuncture or pressure. When we are giving acupuncture, we tend to look at the pulse. If you see variations in the pulse, so it's a vast subject, but if we tend to see any variations in the pulse, so according to the variation that we see, we can understand what is happening inside the body. So it has to be either of these three, either deficiency or stagnancy or heat. So we have to choose points that act well in bringing these back to normal. Yeah, so we are giving acupuncture that way, or acupressure. So what happens is that we are recorrecting your body, or we are tuning your body into a right way that it gets out of these things. So when this tuning happens, or when the recovery happens with these three syndromes that we are seeing, it means that your body naturally tends to get out of the fight that it was doing, or naturally gets out of the trouble that it was facing. So when that shift happens, the internal circadian rhythm gets aligned, your blood flow gets right, your energy flow gets right, and eventually the underlying cause for your infertility is treated, or the unexplained infertility that was still bothering you gets treated through. So basically, with acupuncture or pressure, it's not like once you take it and you're settled. It might require a few sittings depending on the nature of the condition, or depending on the extent of help that you would require. The sittings will be planned. Ozone therapy. So this might be something that is new for a lot of people. So ozone is nothing but the purest form of oxygen. When I say, we would have all heard about the ozone layer. That is what we were listening about, this global warming, where they said there's a hole in the ozone layer. There's because of that, people are going to face a lot of bad effects. The same ozone, but here you cannot really breathe ozone. Oxygen is the breathable form. Ozone has its benefits. But what we do is we take this oxygen and convert it into ozone through a converter. And then through certain different forms of therapies, we get it introduced into your body. So every little cell inside your body gets this oxygen, gets high on oxygen, and that repairs a lot of cellular damages that's been happening inside your body. So this can be given in forms like breathing ozone through oil, or it can be given in the form of anal insufflation, nasal insufflation, vaginal insufflation, or sometimes through intravenous drips. When we look at a particular condition, or when we look at a particular patient, depending on the need of the patient, the dosage of ozone will be altered. So it can be given in minimal doses in multiple sittings, or in a high dose in one single sitting, or it can be every day, or it can be weekly once. But after the said amount of said number of sittings that are being done, we can see certain significant changes that are happening. So with ozone therapy, we had seen, or the research papers do have evidences where they used ozone therapy to treat people with ovarian torsion, occlusion of the fallopian tube, certain infections of the vagina, or pelvic inflammatory diseases. So how they treated this particular thing, they had, most often in a lot of these cases, they had used two different forms of ozone. One is the IV drip and the other one is the vaginal insufflation. So when they did it for 12 months, I think the ovarian torsion people were able to recover and get pregnant. And when they were able to do it for 3 months, the genital inflammatory conditions and vaginal infections got better. So with this course, I think when we see all these people with fallopian tube occlusion or ovarian torsion, we generally feel those are very difficult cases to handle with, because condition is quite complicated, and it cannot just simply be sorted with diet, or it cannot just simply be sorted with the exercises. But ozone can penetrate deep into every cell, and because of its ability to do that and correct cellular damage, the positive changes in such complicated cases do happen, and they feel that it's a miraculous therapy, and it did help them after so many years of trouble going through different treatments to get pregnant. The last one would be the photobiomodulatory therapy, which can also be called as one form of laser therapy or light therapy. So the success rate with this therapy is almost like 65%. How this therapy works is it acts on your mitochondria. Mitochondria is nothing but the powerhouse of your cell, right? So it releases energy for a lot of things. When your mitochondrial activity is not optimal, or when it is affected, the energy that is required for your bodily functions get affected as well. Okay, so because of that, there may be a certain level of inflammation that is happening inside your body, and that could lead to infertility. So this laser therapy helps in correcting that. Okay, so we have particular wavelengths at which this light can reach your body, and different colors of lights like red, blue, green, violet. Say if you have PCOD, then we focus on a particular area of your body, and we give a particular wavelength and particular color of light. And when that reaches your body, there are some components called as chromophores that is present in every cell and in every cell organelle. Particularly in the mitochondria, the chromophores are really high. They absorb this light, and then they reduce the oxidative damage that is happening inside, and also they help in stimulating the mitochondrial activity and release the energy that is required. Okay, so that is how the photobiomodulatory therapy, also called as the laser therapy, comes into action. And I've seen people who have come with PCOD, or I've seen people who have come with fatty liver, and also those people who are trying to get pregnant. So when they come, let's say for fatty liver, we choose the area of liver, and then we give this laser therapy, and that helps in dissolving their fatty liver along with the other dietary modifications. The same way, when we see PCOD cases, we used to give laser therapy on acupuncture points, those points that help in curing PCOD. We choose those points and we give light therapy over those particular points. And when this light reaches the cells in that area, that acts much faster than normally giving laser therapy. So this therapy eventually increased the fertility rates by 65. Like if we get 10 clients, like 6 to 7 out of those patients do have positive results. And this photobiomodulatory therapy is a new kind of therapy, and it is being used as an adjunct therapy with naturopathy, with allopathic practices, and with functional medicine practitioners. And it has been having a lot of good results lately. Traditional naturopathy treatments. So we've talked about all those that are on the top, but there are also treatments like hydrotherapy, mud therapy, where we use water, mud, or steam, or air. All of these things to regulate your body. In this, I would say we have a lot of packs. Like we would have all heard about abdomen pack. There are pelvic packs. There are hot, cold packs. So every temperature, every form of this treatment has a different effect. So, okay, let's say we have someone who's coming here with recurrent UTI infection. So we usually suggest them a pack called tea pack, which is warm in nature. So when they tend to use that tea pack over their pelvic region, it gets better. Tea as in not TEA, it's just the shape of the letter T. So when they tend to use that particular pack over a period of 21 days, they themselves see a lot of difference in their body. The nature or the recurrence of UTI gets reduced. The frequency at which they get UTI gets better. But it's not just this is the only form of treatment. It happens with all other treatments as well. But it's just an example on how just a simple pack could create a great impact on your body. Similarly, steam bath is very, very helpful in sending out all the toxins. Sauna acts very well on eliminating toxins. We have immersion baths like bathtub, and then you get into that tub of water and you remain there like for 15 to 20 minutes. And we use a lot of herbs inside. So when we use those herbs can be by the wet skin, and then the particular components in that herb acts on your body and it gives better results. Like that, there are a lot of water-based, mud-based, air-based treatments that we could use, and also massages. Massages are like one of the best therapeutic modalities for a lot of conditions. We think massage is only for relaxing our body, but massages can be of great help in releasing muscle knots. Massages can be of great help in eliminating the stored up toxins inside your body. So in that way, bringing into picture the traditional naturopathy treatments along with all that could be best used in the technology, in the current technology, can be found very helpful in the whole course of infertility treatments. Therefore, naturopathy treatments can be used either as mainstream or as an adjunct treatment, depending on the presenting signs and symptoms of the patient. In the current era, where all our lifestyle habits have been like haphazard, naturopathy could be a boon for many couples struggling to get pregnant. It would have been evident to a lot of people, like just sticking on to all the new advanced techniques in the field of medicine could not be the only measure that we take, because even with all that, still a lot of people are struggling to conceive, right? So bringing in all these basic changes in the lifestyle could be a simple but a very, very effective modality of therapy for a lot of couples. Thank you. And looking to the questions, is there any food group that needs to be avoided if one wants to conceive, or is vegetarianism can lead to iron deficiency? Any specific seed that we can suggest during? Okay, there is nothing like a particular seed during pregnancy. You can actually include a lot of seeds, and seeds can just generally help you in improving vitality. Seeds have a lot of good fats. They come with omega-3 and 6 fatty acids. They are power packed with that. So seeds can be of great help. There's nothing like this is the only seed that you should eat. This is something that you should not eat. Nothing like that. And vegetarianism doesn't mean you'll have iron deficiency, because we still see a lot of non-vegetarian people who come with ferritin, like low ferritin levels. And we also see a good amount of vegetarian people who come with good ferritin levels. So it basically is how you plan your meals and how your body is able to absorb that particular nutritional content from the meal. If your body's gut is doing good, and if it can absorb all the nutrients properly, and if you are providing yourself with good amount of nutrients, then that should do. It's nothing about veganism, vegetarianism, non-vegetarianism. That all comes secondary into the picture. Okay. There's no food group that you need to avoid, but you should definitely avoid junk. So as I said, junk can never be a food. So avoiding junk could be of great help if you're trying to conceive.
Thank you for this lovely presentation, and it was very interesting to explore alternative therapies with you, especially the ozone laser and simple interventions like, a good massage therapy can also be quite effective, right? I wanted you to share with our audience how they can get in touch with you if they have further questions or they want to connect with you. That would be great.
So if you have any questions, you can just reach out on my Instagram page or my contact number. I think I'll share both of it on the chat box.
That would be great. Yes, thank you. So you can connect on Insta at House of Nature Cure. That's where you can find Ashwathika, and she's also shared her direct contact number. Please make a note of that. Well, Ashu, thank you so much. And please continue all the lovely path-breaking work. Asha has a question. She has asked methods of cooking. Does that also make a big difference?
Of course, it does. Let's say, for example, vitamin B is a water-soluble vitamin, and it just melts away with water. So you see a lot of vegetables that contain vitamin B12. We do include it in our daily life, but then we overcook it. We tend to boil it a lot, and then the vitamin B12 goes away with the water, and we eat the empty vegetable. So in those cases, like mindful cooking or conscious cooking, whereas we include the right amount of raw foods and the right way of cooking, where you introduce the food to heat to a lesser extent, might be of great help. And sometimes also with fats, like if you see coconut oil or ghee, it has a lot of good fats in it. But then if you heat it to a greater extent, like if you fry something in it, then it turns to be a trans fat. So cooking methods do play a major role in nutrition.
All right. Thank you for that explanation, and thank you so much for your presentation.
Thank you so much.